Hi everyone, Ron Place here, checking in from outside my office in the Pentagon courtyard. It's quiet around here and at the Defense Health Headquarters with so many of you doing what we've asked you to do, work from home. I miss seeing you, but I appreciate that you're making the extra efforts and necessary adjustments to continue the DHA's important work. Occasionally, I also work from home during this national emergency, but it's not always possible. When I'm meeting with other DoD senior leaders, we're all practicing social distancing and wearing face coverings, which is required right now in the Pentagon and DHA facilities. Like you, we're doing our part to flatten the curve. Things are trending the right way, but don't get complacent. As my friend and colleague Admiral Gillingham recently said, stealth is this virus's superpower. If you let down your guard, you're inviting unnecessary risk, so stay focused and continue following DoD and CDC guidelines. We need you to stay healthy because, as we've seen, it takes all of us working together to fight this enemy. Now, you haven't seen me as much at your locations because I've curtailed travel for obvious reasons. I've visited some of our frontline workers here in the National Capital Region, but I've even limited those visits on purpose. Look, I was an MTF commander. I know it can be disruptive when a senior leader shows up. And while there are definitely times when it's appropriate, now isn't one of them. Please know that my absence is for your benefit and not some sort of subtraction of my gratitude for you or the important work you're doing. Now, you've probably heard this fight against COVID-19 isn't a sprint, it's a marathon. But the fact of the matter is, some of you are running this marathon at a sprinter's pace. The op-tempo is something many of you have never experienced, except maybe for some who are treating casualties during the height of operations in Iraq and Afghanistan. And while this is different, the demands are real, and those of you in the middle of it recognize that more than anyone. I can't adequately express my gratitude. You're treating patients in DoD facilities, makeshift hospitals, civilian hospitals, and on Navy ships. You're screening those entering our hospitals and clinics, seeing patients with scheduled appointments who still need your hands-on care and expertise. You're working around the clock in labs and research facilities, doing everything you can to test, find a cure, and develop a vaccine. You're doing administrative work to meet our obligation to support MTFs, depending upon us. You're communicating with our TRICARE beneficiaries so they better understand this unfamiliar environment. You're coming up with innovative solutions to reduce potential exposure to the virus, like ramping up telehealth capabilities and providing drive-up pharmacy services. You're supporting our combatant commands with our unique military medical combat support capabilities. And you're continuing to perform the regular work that must endure. It's truly a remarkable collaboration of professionals operating together as one team. Most importantly, you are serving on the front lines of this fight and delivering every day on the Secretary's priorities to protect our people, maintain readiness, and support the national response. Again, thank you. You have my total support, and I'm so proud of you and honored to call you my colleagues. Stay safe and stay well.